Our next speaker in this session is,
Speakers, plural.
Sorry, speakers. Yes, sorry, Sara and Hudson. And you're coming to us from Townsville Hospital and Health Services. And today you're going to be talking to us about the really important topic of HRECS as gatekeepers in relation to methodologic integrity. And this is often, as many of us would know, a criticism that's directed at HRECS in terms of some of the comments and questions we might be asking about methodology from a research merit and integrity process. So I'm really looking forward to hearing your perspective on that. Thank you, Sara and Hudson.
And we're taking the open forum literally. So ask questions as we go along. And Liz, please feel free to bring them up if we get too busy to see them pop up at the bottom.
For sure.
Thank you, Liz. Thank you for that lovely introduction. Yes, Hudson and I are from the Townsville Ethics Committee, and we're really pleased to be talking to you today. First of all, we'd just like to acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea and community. We pay our respects to them, to their cultures and to their elders past, present and emerging. I'm presenting from my home office today, so I apologise in advance of any background noise that you might hear. And I'm located in Townsville, so we are a defence city, so we might get a flyby and a bit of noise. So I'll try to keep my speaker on mute when I'm not talking. So this year we have seen the rapid publication of COVID-19 related studies and research. And whilst there is a need to have access to current information to treat, manage and respond to the health crisis, as highlighted by the welcome statement, an uncomfortably large portion of that research over the last 10 months has subsequently needed to be withdrawn as its flaws have come to light. This has led to what's been called scientific pollution and is contributing to the current issue of research waste. And as a result, the health community is scrambling to keep up to date and treat their patients safely and quickly. And we've also started to see these problems of public perception of untrustworthiness in the scientific process, which is also including increased skepticism of the developing vaccine solutions. It's become a very recurrent set of circumstances, which was also highlighted by Professor Ian Freckleton on Wednesday in his talk. And with the Tamiflu and Wakefield incidents, certainly two examples of this. What we've seen is we believe that there's a real need now to think about what HRECS can do to ensure the integrity of this published scientific research. Over to you, Hudson.
Particularly, there were two studies by MIRA that were published earlier in the year and subsequently withdrawn, and they were in two of the most prestigious journals going. Post hoc analysis of these studies revealed obvious and serious flaws: failure to control for biases and confounders, flaws in methodologies used in data analysis, and discrepancies in the reported nature of symptoms experienced by patients. And finally, after the papers were published, somebody realized that the number of participants reported from Australia was greater than the number of people in Australia that had caught COVID by many factors. So some obvious flaws that the journal reviewers didn't pick up. And our argument is that HRECs are better positioned to pick up such flaws in the review stage than our reviewers. Many of you, as I, have probably reviewed for many journals, and it's a fairly thankless, unrewarding process that one doesn't ever divulge much time to. Going through the data is tough enough without assuring the source of that data. Not only did these studies that were withdrawn reveal a lack of adherence with data sharing as we have it, but the principal investigators had a vested interest in the company which provided the data used for the studies. And so we're arguing that instead of being considered low-risk studies, it's possible that large data studies do need to come through HRECS for review. Assurance of complete methodological soundness, to the degree that can avoid the failings that we've seen in these papers, are beyond the mission and capability of some, but not all, HRECs. But our reviewers likely spend more time and devote more detailed scrutiny to research proposals than do journal reviewers. Being both a reviewer and an HREC chair, I can vouch for that, and vouch for the number of times I've reviewed a paper and found many things that other reviewers hadn't found. And we also carry out our work in close consultation with peers in a team environment, not as a solitary, isolated endeavor, which is what journal reviewing is. Australian data services have an important role in the data sharing landscape, and we are the gatekeepers of that. So since we have the expertise and are appropriately placed at the beginning of the review process, our argument is that we stand in a place where we could prevent such things from happening. In the new era of data sharing, it's essential that transparency and integrity not only are maintained, but are seen to be maintained. We're not offering an absolute solution, but as I say, since we're strategically placed at the start, it could well be that for large data projects, a loop through an HREC before the study starts could be a step, one element in preventing flaws like the publication of these mirror studies, which were on hydroxychloroquine, from happening again. Pause for questions. And Sarah, anything you want to add again?
We do have quite a lengthy comment in the chat just around some of the strategies that one particular person has used to address some of the issues of research merit and integrity. So I don't know if you've managed to have a look at that, Hudson or Sarah. I guess it's really just ensuring that in terms of the flow on to participants. Okay, so well, it was more in response to the previous talk than this one, but I think part of research merit and integrity is how we also communicate that with our participants and the ways we build that into the process. That's one of the things I know that as HREC members we do look for when we're considering research merit and integrity.
Well, while we're waiting for questions or comments to come in about this issue, you know, one of the things that Ian Freckleton said on Wednesday is that, you know, in these sorts of health crises, it's very easy for there to be cases of exploitation and research fraud and research misconduct, and I think that's what we've seen here with these mirror studies. And he also highlighted the difficulty in being able to identify or prevent that from happening early on. And what Hudson and I are proposing here is that because of that position of ethics committees being involved in a review or assessment process in the planning stages, that perhaps we can encourage researchers to uphold those principles of integrity and remind them what their responsibilities are when they're conducting any research. One thing that I'm sort of thinking about here around this issue is these big data studies, once they're established and we see these downstream analyses happening, they're then usually considered to be exempt from ethics review. So it's a case of being considered negligible risk because usually the data that's being held is de-identified and is being made available for reuse, which we want.
Is retrospective.
Yes. So I think my concern here is if they're considered to be exempt from review, do researchers then believe that they're exempt from having to conduct the research in an ethical way because they're not being asked to consider those ethical principles because they're not having to do an application or justify their study to a review panel until they get to that journal process?
There are other solutions that have been suggested in the literature. Distributed ledger technology or blockchain, which is what is part and parcel of cryptocurrencies, has been suggested as a way through which data can be traceable and verifiable as reliable throughout a project, no matter how long and complex it is. I remain a skeptic on blockchain technology, but it has become more prominent. There's also computational social science, which can identify and exploit multifarious dependencies within the data, quote from the literature. And there's a paper by Ferreira and colleagues, which have suggested a framework for this. And it looks like the next chat question also was more relevant to the last talk than to ours.
So I suppose we could talk about then what is in place for ethics committees to do when you do receive an application for a big data study that does require review and wouldn't be exempt. There are some really great principles and guides that you can use to consider the risk and making sure that those projects are being planned with integrity. So first of all, we look at the FAIR principles, which is the fair data sharing framework provided by the Australian Research Data Commons. And they are findable, accessible, interoperable, and reusable. So you can find these on any of the Australian websites relating to the FAIR principles. It is an international set of principles that we've adopted here in Australia. And there's also a couple of really great tools which researchers and reviewers alike can use to assess whether or not the data is meeting those principles. The national statement also provides some great guidance around assessing risk and integrity in the use of participant data. There's a table in one of the chapters that talks about key questions for HRECS to consider. And I believe that's in section 3, if anybody wanted to go and have a look at it. But the key questions are: what data or information is required to achieve the objectives? How and by whom will the data or information be generated, collected, or accessed? How will the data or information be used and analysed? How the information will be disclosed or shared, and if so, with whom? How will the data or how will the risks associated with the collection, use, and management of the data be managed and minimised? And how will the collection and management of the data adhere to the ethical principles? So what that means is what ethics committees can do now is when you're reviewing an application for something that's going to be set up as a big data study, or that's going to have potential for reuse and sharing in the future, like the Surgisphere database that was used in these 2 mirror studies, ethics committees can firstly ensure that the FAIR principles are being upheld in the data management plan. So first of all, making sure that there is a very well described and explained data management plan outlined in the application. So some researchers might include this as part of their protocol, but they also can do it as a separate document that just discusses that management. The other thing that obviously is a huge focus point here is about informed consent. So how are participants being told about how their data is going to be used and potentially shared in the future? And is that informed consent process clarifying for them the unknown potential for future use as well? So that's something to think about. And you can read more about unspecified consent for future use in research in chapter 2 of the national statement. Another thing that I believe ethics committees are really well placed to do, because we have an important role in the institutions that we support, is that we can encourage our research institutes and our research departments to put some data management processes and policies in place within those institutions, which helps support researchers to make good decisions when they're planning their studies, and reminds them about those ethical values that they have to uphold right from the beginning of planning the study, down to those negligible risk downstream analyses projects where they will be reusing and reanalyzing the data for different purposes, or asking different questions of it. Another thing I think that ethics committees can do probably a little bit more consistently is advising researchers on the privacy legislation in Australia about data use and disclosure of data. Anybody who attended the session on Wednesday afternoon on privacy essentials from Salinger Privacy, she talked a lot about how we can uphold those privacy principles and developing our understanding of them. And I think that ethics committees not only have a role to do assessments and reviews, but we also have a role and a responsibility to educate our researchers in what their roles and responsibilities are around this, and make sure that they're well informed about the legislation that might apply to the nature of the study that they're doing. I see we have a question here. I'll just hand over to Hudson to look at.
And lastly, the Wellcome Trust published at the beginning of the year a framework for data sharing, particularly in emergency situations, and they've just recently updated that. So that is a good go-to point for data sharing in these situations.
So Hudson, in the question and answer, there is a great question, and it's one that, as I mentioned earlier, we're often criticised, is this common view that HRECs can only comment on ethics and not scientific methodology. How do you think this can be addressed? And I know for my part, when I'm asked that question, I often say, well, there's a misunderstanding by many researchers about the significance of research merit and integrity as an ethical principle. I wonder if you'd like to comment on that.
A poorly designed and executed study can't be an ethical study, and a close reading of the national statement makes it, I think, abundantly clear that we do have the obligation to look at methodology, to critique methodology. And we've encountered this discussion in Townsville, people surprised that we would question their methodology to the depth that we do. I think it's integral to what we do. I think it has to be.
I couldn't agree more. Thank you. Please join me in thanking Sara and Hudson. A great discussion around research merit and integrity in our work on ethics committees. Thank you very much.
Bye.